We have kids coming in with their appendix has been bothering them for 3 days. The parents are finding everything that they can to try and avoid going to the hospital. Maybe this medicine, maybe some Pepto-Bismol. And then they come in and their appendix is ruptured. And they end up staying in the hospital for 5 days on antibiotics and with their life at risk. And these are the things that can be avoided. People who have high blood pressure and they can't afford the medication, they end up with kidney failure. And then they're on dialysis and looking for a transplant. And I mean, it just snowballs because these people aren't getting the care that they need when they need it. You know, I see it in the operating room all the time where people are coming in with gangrenous gallbladders. They're very, very sick when they finally come to us. We have to take care of these people. Why not pay $100 for high blood pressure medicine instead of thousands, hundreds of thousands of dollars for dialysis and possible transplant? Our hospital has just recently been through some layoffs, and because the hospital can't afford to take the burden of this on their own. It's a major corporation that I work for. They used to be one of the profitable corporations around, but as more and more people are laid off because of the economy, the burden is becoming more and more on them. It takes away the healthcare workers. Now we can't take care of the patients in the fashion that we've liked to. Every day that we don't do something about health reform, that will be a waste of all that money that we put in it. Because every day we're talking millions of dollars and millions of lives being affected. And I mean, that's the urgency. The urgency is that 100 people in our hospital are having to be laid off because the hospital can't afford to take the burden. And if we don't do something in 6 months, I don't know what's going to be left. What are the lines going to be like with the hospitals that are still open? You know,